Attachment-based therapy in practice. Attachment-based therapy offers a nuanced lens through which therapists can understand and intervene in relational dynamics. Grounded in the theory of attachment, originally developed by John Bowlby, ABT emphasizes the importance of early relationships in shaping an individual's relational patterns throughout life. It posits that the quality of attachment bonds formed during childhood significantly influences emotional regulation, interpersonal relationships, and mental health. This therapeutic approach seeks to address maladaptive attachment styles by fostering secure attachments within the therapeutic relationship, helping clients achieve emotional healing and relational transformation. At the core of ABT is the principle that early attachment experiences create internal working models, which serve as templates for future relationships. These models can be secure, anxious, avoidant, or disorganized, each with distinct patterns of behavior and emotional responses. Secure attachment is characterized by comfort with intimacy and autonomy, while anxious attachment may lead to preoccupation with relationships and fear of abandonment. Avoidant attachment often results in discomfort with closeness and a tendency to prioritize independence over relationships. Disorganized attachment, typically resulting from traumatic or inconsistent caregiving, manifests as a chaotic mix of behaviors and emotions in relationships. The therapeutic process in ABT involves creating a safe and trusting environment where clients can explore their attachment histories and patterns. The therapist acts as a secure base, offering consistent support and validation, allowing clients to express and process emotions that may have been suppressed or distorted due to maladaptive attachment styles. This corrective emotional experience can lead to the development of more adaptive internal working models, enhancing the client's capacity for healthy attachments outside therapy. Pause. One of the practical strategies in ABT is the use of mindfulness-based techniques to help clients become aware of their attachment patterns and emotional triggers. Mindfulness allows clients to observe their thoughts and feelings without judgment, creating space for new responses and reducing automatic maladaptive reactions. For instance, a client with an anxious attachment style might learn to recognize their tendency to catastrophize relational conflicts and, through mindful awareness, develop more balanced perspectives and coping strategies. ABT also draws on recent advancements in neurobiology, which underscore the plasticity of the brain and its capacity for change. Research shows that the brain is capable of forming new neural pathways in response to new experiences, including those within the therapeutic context. This neuroplasticity supports the idea that attachment styles, though formed early, can be modified through corrective relational experiences. Therapists can leverage this understanding by employing strategies that emphasize emotional attunement and empathy, which can facilitate neurobiological changes and promote secure attachment patterns. Comparatively, cognitive behavioral therapy focuses on changing maladaptive thought patterns to influence behavior, while ABT emphasizes relational healing as a pathway to emotional regulation and behavioral change. While CBT is structured and directive, ABT is relational and experiential, prioritizing the therapeutic alliance as the primary vehicle for change. However, integrating elements of CBT and ABT can enhance therapeutic efficacy, particularly when addressing complex attachment-related issues. For example, cognitive restructuring techniques from CBT can complement the emotional exploration central to ABT, providing clients with practical skills to manage distressing thoughts while working through deeper relational issues. Critics of ABT argue that its focus on early attachment experiences may overlook the impact of current relational dynamics and environmental factors on the individual's mental health. They suggest that a sole emphasis on past attachment may lead to an overly deterministic view of personality development. However, proponents of ABT contend that understanding the foundational role of attachment does not negate the importance of present relationships, but rather provides a comprehensive framework for understanding ongoing relational patterns and challenges. Pause. Emerging frameworks in ABT have begun to incorporate insights from adjacent disciplines, such as trauma therapy and systemic family therapy, to address the complex interplay of individual, relational, and contextual factors in psychological distress. For instance, the incorporation of trauma-informed care principles allows therapists to recognize and address the pervasive impact of trauma on attachment and emotional regulation, tailoring interventions to each client's unique experiences and needs. To illustrate the application of ABT, consider the case of Maria, a 35-year-old woman struggling with persistent relationship difficulties. Maria's anxious attachment style, rooted in a childhood marked by inconsistent caregiving, manifests as a constant fear of abandonment in her relationships. During therapy, Maria's therapist uses ABT techniques to help her explore and understand her attachment history, recognizing patterns that have hindered her relational satisfaction. Through the therapeutic process, Maria experiences the therapist as a secure base, gradually developing trust and learning to regulate her emotional responses. Over time, Maria begins to establish more balanced relationships, marked by healthy boundaries and emotional attunement. Pause. In another case, James, a 45-year-old executive with avoidant attachment tendencies, seeks therapy after his marriage faces challenges due to his emotional withdrawal. James's early experiences with emotionally distant caregivers have led to a reluctance to engage emotionally, impacting his ability to connect with his partner. Through ABT, James is guided to explore his discomfort with intimacy and the underlying fears driving his avoidance. As he experiences the therapeutic relationship as a secure base, James gradually learns to tolerate vulnerability and cultivate emotional intimacy with his partner, leading to improved relational satisfaction. ABT's interdisciplinary nature allows for its integration into various therapeutic contexts, from individual therapy to couples counseling and family therapy. Its focus on attachment and relational healing aligns with the goals of systemic family therapy, which emphasizes the interconnectedness of individual and relational dynamics. In a family therapy context, ABT can be used to address maladaptive family patterns and promote secure attachments among family members, fostering a supportive and nurturing family environment. In conclusion, ABT offers a rich, multidimensional approach to therapy, emphasizing the healing potential of secure attachments. By integrating theoretical insights, practical strategies, and interdisciplinary frameworks, ABT provides a comprehensive model for understanding and transforming relational dynamics. Its focus on the therapeutic relationship as a catalyst for change underscores the importance of empathy, attunement, and trust in facilitating emotional healing and promoting psychological well-being. As the field continues to evolve, ABT remains a vital component of integrative therapeutic approaches, offering a path to healing through the power of connection and relational transformation.